Other important thing to know is seizure is extremely treatable. What happens, the most difficult thing about epilepsy is the stigma, the social stigma. Like people think that they should hide this disease. There is something wrong with their brain that may portray them in the society that they are not enough, they are not smart, but it is not. There are many eminent personalities like Leander Pace, like many other famous painters, Van Gogh, they all had epilepsy. And you have seen them reaching the peak of their career. So I would say that this disease doesn't stop you from achieving anything. The only restriction for seizures are the driving and the swimming activities, because in that moment, if you have a seizure and if you won't recognize it, it may be fatal to you or someone else. Apart from swimming and driving activities and some of the high risk sports, actually epilepsy does not affect anything in your life. You can have a normal education, normal job, normal married life, and you can have healthy kids, normal pregnancy, you can do breastfeeding. So all these things which happen in a normal phase of any individual can happen to you too. And I think that's the most important thing to know about epilepsy. This is not a disease which limits you, but the attitude towards the disease and the misconception that society has is actually limiting it. And I think that is affecting the awareness. That's why people are not coming forth. Whom should we approach? So we should approach a neurologist, and better epileptologist, that is a neurologist who has a special training into epilepsy. Though most of the neurologists can take care of all the seizures, there will be some seizures which are considered as drug resistant, that is refractory. That means you are giving them drugs but they are not responding. In those cases, you may need an epileptologist, that is a person who is more trained into dealing with complex epilepsies.